In any couple, it's the man who is statistically more likely to have a heart attack. And that very fact, it seems, affects how some medical staff treat women who present with symptoms. When Gemma had a heart attack in Newcastle last year, she was initially sent home.
Yeah, I think you need to take women more serious about their symptoms and realise that it can happen to women, not just men. I was getting chest pain and jaw pain and like a heavy arm. So obviously I went to my GP and they said it was anxiety or indigestion because I suffer with heartburn to start with. But, and then sent us home and that was it.
A 10-year-long study found the death rate for women in the first weeks after their heart attack was 5.2%, more than double the 2.3% figure for men. Women were 34% less likely to have an angiography check of their arteries and were less likely to get a stent, statins or beta blockers. Researchers say there were more than 8,000 preventable deaths of women.
There's likely to be an element of bias and an element of biology involved in this, but we also know that women can present with slightly atypical symptoms of heart attack. They have slightly different risk factors for heart attack.
Mom! I think you're having a heart attack.
Honey, do I look like the type of person who has a heart attack?
TV ads in America already highlight that women are less likely to have chest pains, but instead might suffer dizziness, nausea and sweating during a heart attack. There are calls for better public health awareness here.
We do recognise that there should be a lot more education for women to recognise their symptoms and to take them seriously. So if they are having any unusual pains, strange sensations that are just not normal, they need to seek medical advice, they need to see a doctor.
A walking group in Newcastle today for good heart health. But what many people don't realise is that heart disease kills more women than breast cancer. Further steps are needed to raise awareness in patients and doctors. Peter Lane, 5 News, Newcastle.